alaikum. My name is Minahil Maqsood. I am roll number 139 from final year morning. The topic which I am presenting here is Dobutamine. Dobutamine is a synthetic direct acting catecholamine. It is a beta 1 agonist. Actually, it is a symptomatic drug that is a beta 1 agonist with minimum alpha 1 activity. The drug is usually dispensed and administered as a racemic mixture consisting of both dextrorotatory and levorotatory isomers. Dobutamine has inotropic and vasodilator action of dextrorotatory isomers selectively on beta adrenoreceptors. That's why dobutamine is a potent beta 1 adrenoreceptor agonist on myocardium, as well as it have a alpha 1 agonist and antagonist activity. It is used therapeutically to increase the cardiac rate and output with few vascular effects. It is the beta agonist of choice for the management of congestive heart failure patients with systolic dysfunction. Dobutamine is used to increase cardiac output in acute heart failure as well as for inotropic support after cardiac surgery. Tolerance may also develop after the prolonged use of the dobutamine, and it might be due to its shorter duration of the action. The main mechanism by which dobutamine works or acts is that primarily it works by direct stimulation of beta 1 receptors, which increases the strength of heart contractions. It it do this it do so by activating the adenyl cyclase, due to which an increase in the intracellular cyclic adenosine monophosphate level occurs, and therefore calcium levels also increased, and due to the increase in calcium levels there is a stronger contractions of the heart. The route of the administration for the dobutamine is intravenous. It is active only by the IV route because of its rapid first pass metabolism via catechol O methyltransferase, that is COMT. The indications for the dobutamine are it is indicated mainly for the cardiogenic shock, that is a short term treatment of the cardiac decompensation that occurs after the cardiac surgery. It is also used for the congestive heart failure, and it is also indicated in the acute myocardial infarction. But the care is needed while it is giving for the acute myocardial infarction, because it can lead to the arrhythmias, it can lead to the increased arterial pressure, it can increase, it can lead to the increased heart rate. That's why one must be careful while giving dobutamine for acute myocardial infarction. The side effects that are associated with dobutamine are cardiovascular ones, that are increased blood pressure, increased heart rate, palpitations, and dysrhythmia. Dysrhythmia is basically the abnormality in the physiological rhythm of the heart. The GI associated side effects are the nausea, vomiting, and CNS associated side effect is the headache. There is also a decreased concentration of the potassium level. So hypokalemia is also an adverse effect for dobutamine. The rational or the appropriate use of the dobutamine involves that dobutamine injection is indicated when parenteral therapy is needed for inotropic support in short-term treatment of adults with cardiac decompensation due to the compressed contractibility. However, in practice, less dose is prescribed than the actual dose in cardiogenic shock, so this practice must be rectified. It means that the dose which is actually needed to treat the cardiogenic shock, instead of that dose, the dose less than the actual dose is usually in practice is prescribed in practice. So one should see in this practice and must rectify the dose. The irrational or the unreasonable use of the dobutamine is occurs usually in the clinical practice, while instead of giving the dobutamine is prescribed irrationally or unreasonably. So it must not be occurred, because the irrational use of the dobutamine can lead to certain problems like high blood pressure, increased heart rate, hypotension may also occur, due to the hypovolemia, hypersensitivity due to the presence of the sodium metabisulfite in the drug in those that are sensitive to the sulfide sensitivity. So these problems can occur while due to the irrational use of the dobutamine. The patient with the problem, especially of the hypertension or the reduced blood pressure, so the drug which is need to be prescribed is the dopamine, not dobutamine. So sometimes क्या होता है कि dobutamine prescribe कर दिया जाता है dopamine की जगह पर irrationally. तो उसकी वजह से एक नुकसान तो ये होता है कि टॉलरेंस भी डेवलप हो जाती है पेशेंट के अंदर. तो इसलिए इस प्रैक्टिस को नहीं करना चाहिए और केयर इज नीड टू बी टेकन इन दिस सिचुएशन. The usual dose for the dobutamine is 2.5 to 10 mcg per kg per minute, and it can titrated up to 40 mcg per kg per minute. And the point which is noted to be here is that the dose should not exceed this value, that is 40 mcg per kg per minute, and it is administered only intravenous through intravenous route, also only injectable solution, and the while formulation is are available for the dobutamine, and it is available in different strengths like 250 milligram per 20 ml or 100 milligram per ml, 200 milligram per ml, while injectable solution is available as 12.5 milligram per ml. So the dose for the adult is 0.5 to 1 mcg IV infusion continuously initially, and 2 to 10 20 mcg per kg per minute. And in the infusion form, the drops per minute can be set according to the body weight of the patient, usually for the average body weight of 60 kg, and for the medium dose, like when we are giving 5 to 10 mcg per kg per minute, so the drop rate or the infusion rate can be set as 42 drops in 14 minutes for a 70 kg patient. So it is accordingly to the clinical situation or need of the patient. And the dose recommendation in the pediatrics is that for all age groups from neonates to the 18 years, an initial dose of 5 microgram per kg per minute is recommended, and it is adjusted according to the clinical response of the child patient, and it is set in the range in 2 to 20 microgram per kg per minute. The drug interactions for the dobutamine are: it can interact with the anesthetics cyclopropane, halothane, and with the monoamine oxidase inhibitors with tricyclic antidepressants. And interaction with all these drugs due to the increased risk of the arrhythmias or the hypertension. As these all drugs can also increase can cause the arrhythmias and the hypertension, the dobutamine can also do so. So they interact with each other and have a synergistic action. Beta blockers may nullify the dovitamine's response, so beta blockers cannot or should not be given with the dobutamine. And the use of the dobutamine with the nitroprusside may have a synergistic effect on the cardiac output. Dobutamine HCl should not be mixed with other drugs in the same solution. Do not add dobutamine injection to 5% sodium bicarbonate injection or to any other strongly alkaline solution. The alternatives for the dobutamine are, one of the alternative is milrinone, that is the phosphodiesterase 3 inhibitor, and it can be used as alternative in the treatment of the severe heart failure because milrinone exerts hemodynamic effects with less increase in the heart rate or myocardial oxygen consumption than dobutamine. Also, it is more effective than dobutamine in the presence of the downregulation of the myocardial beta adrenoreceptors because of either high intrinsic symptomatic tone or sympathetic tone or beta adrenergic blocking agents. But the one problem is that which is the main issue for the patients is the economic, from the economic point of view, is that the milrinone is not cost effective as compared to the dobutamine. So mostly dobutamine is preferred over milrinone. Another option to be used as an alternate of the dobutamine is dopamine, because it improves the cardiac index significantly. But the problem with dopamine is that it causes greater increase in heart rate than dobutamine. Contraindications. The dobutamine is contraindicated in pregnancy because it is a pregnancy category B medicine. It should not be given to the lactating mothers. It is contraindicated in children. in children. Use with caution in patients with hypertension or cardiac arrhythmias, because I have already mentioned, it causes the adverse effect of the arrhythmias and it has a side effect. So it must be contraindicated in those patients already have this kind of problem. Contraindicated in those having the sulfite sensitivity, as the drug contains this element and the metabisulfite as is an active ingredient. So contraindicated in those having the sulfite sensitivity. Used with caution in atrial fibrillation as it has effect of the increasing AV conduction. While if you want to give the dobutamine in the atrial fibrillation, then pre-treatment with digoxin is recommended. So first treat the patient with the digoxin, then we can continue or we can give or initiate the dobutamine. Dobutamine HCl is prohibited in patients of idiopathic hypertrophic subaortic stenosis. It is a disease that is characterized by marked hypertrophy of left ventricles. Hypertrophy is the thickness of the heart muscles. So in this disease, it is prohibited. It must not be used in the hypovolemic conditions. If you want to use, if there is a need to use and there is a condition of the hypovolemia, so this condition must be correct first, and before the administration of the dobutamine by administering the fluids and the blood transfusions. The toxicity, overdosage of the dobutamine have been reported rarely. Toxicity of the dobutamine acid is usually due to the excessive cardiac beta receptor stimulation, and the symptoms of the toxicity include anorexia, chest pain, tremor, palpitations, vomiting. The antidote for the overdosage is that the first action to be taken in dobutamine overdosing is that we have to discontinue the administration, we have to discontinue the therapy, as it has a very shorter duration of the action. So the only solution we have in its toxicity is that we have to stop the therapy immediately. Then the second thing we have to do is that we have to ensure the oxygenation and the ventilation. If side effects like chest pain or arrhythmias of the overdosing do not resolve even after the discontinuation of the therapy or the drug, then give the metoprolol 1 to 5 milligram or esmolol intravenously to overcome the side effects. There are the different brands and the prices available in our country for the dobutamine, as it is only available in the injection and the infusion form. The only dosage form is available is injection and the infusion, and there are different brands like Buta, Dobutamine, Dobutrex, and mostly they're in the strength of 250 milligram per ml vial, and the prices ranges from the low one is 230 and the highest one is 2750. So one with the lowest price can be used. It all depends upon the one's affordability. So the person can the physician can prescribe or the patient can choose according to his affordability. The case study associated with the my drug dobutamine is that a 70-year-old man with advanced prostate cancer and ischemic cardiomyopathy and a left ventricular ejection fraction of 18% is brought to the emergency room after two episodes of near syncope. Syncope is the temporary loss of the consciousness. He is somnolent, means he's feeling sleepy and he's abnormally drowsy, and falls asleep during the interview. He is on very low doses of angiotensin converting enzyme inhibitors and did not tolerate a beta blocker as an outpatient because of low blood pressure. His baseline creatinine is 1.8. His heart rate is paced at 70 bpm and blood pressure is lower than usual at 72 by 55 millimeter of mercury. His extremities are cold with a trace edema, and he is oliguric. Recommend treatment. The SOAP notes involve subjective. The age of the patient is 70-year-old male, and his chief complaint is left ventricular ejection fraction that is only 18%, and it shows its cardiogenic shock, and the heart is not pumping the required ejection fraction. He has a history of advanced prostate cancer and is also has ischemic cardiomyopathy. Current medications, low doses of ACEI earlier on beta blocker, but not tolerated them. Vital signs include, as already told, left ventricular ejection fraction, 18% episodes of unconsciousness, and slightly edema, and cold hands and the feet, and low blood pressure, low urine output, that is called oliguria. It is also known as the hypouresis. The lab reports show baseline creatinine is 1.8. However, it is not that much less that we have to worry about it. Assessment is that the patient is suffering from cardiogenic shock with organ dysfunction, which is a class 1 indication for temporary inotropic therapy to support perfusion. The patient is not a candidate for heart transplantation because of his malignancy. Because as the patient is very old page, he already जो suffering from the ischemia cardiac myopathy, that is basically the heart muscles are unable or have make it harder to pump the blood from the heart to the other parts of the body due to the narrowing of the coronary arteries. So the only solution to this problem is the transplantation, but he is not a candidate because already he has a very other problems, and that is a low blood pressure, and he always feels sleepy and he is very weak, and is not a proper or the suitable patient for the transplantation. So the plan for this case study is that we have to treat the emergency situation. Here we have only the concern about the treatment of his cardiogenic shock, and the treatment about his ejection fraction. We no need to give the treatment for the cancer or for the other problems. The only concern of ours here is to give him the treatment for the ejection fraction, and it is concerning our drug. So we will give him the dobutamine in initial dose of 1 to 2 microgram per kg per minute, then maintenance therapy or the dose of 7 microgram per kg per minute IV infusion. However, we cannot give him, he has already tolerated the beta blockers, and his blood pressure is already very low and is oliguric. We cannot give him the diuretics for the oliguria, because already his blood pressure is very low. By giving the diuretics, his blood pressure may fall even lesser than now. And furthermore, we cannot give him the a fluid therapy for the low blood pressure to treat his low blood pressure, as he is the heart patient. So the only solution for now to give him the dobutamine in the initial doses, and then for the maintenance therapy. Furthermore, we can add on the dopamine combined with the dobutamine if the low blood pressure resists or the retains persists or retains. However, how after patient becomes stable, advise the treatment for the prostate cancer or refer him to the oncologist or the urologist. One more thing I would like to mention here is that these type of inotropic infusions allow the patient to be discharged home without if he has not if he not has any congestive symptoms, as he is not the candidate for the heart transplant. It has become acceptable now to prescribe the long-term outpatient inotropic infusions, usually dobutamine, purely as a palliative measure. And the patient and the family must be educated in this regard for the inotropic therapy, and it can and tell them about the therapy, that it can be titrated off as an outpatient. And furthermore, many patients but there may be an overall risk of the death for the patients that want to go home, but many patients accept the risk in exchange for opportunity to leave hospital and spend their remaining time at the home. The references are given here. Thank you.